Have you ever wondered how your body sends signals so fast? It's like having super fast internet cables running all through you, connecting your brain to every part of your body. These cables are your nerves, and they're wrapped in a special coating called myelin. Think of myelin as the insulation around an electrical wire. It helps messages travel quickly and efficiently, allowing you to think, move, feel, and do everything you do without a second thought. But what happens when this insulation gets damaged? That's when we enter the world of demyelinating diseases. Demyelinating diseases are a group of conditions where the myelin sheath around nerve fibers is damaged. When this protective layer is lost, nerve signals can slow down, get scrambled, or even stop completely. This can cause a whole range of symptoms, depending on which nerves are affected. It could be your vision, your ability to walk, your sense of touch, or even your thought processes. One of the most well-known demyelinating diseases is multiple sclerosis, or MS. In MS, the immune system, brain and spinal disease. This attack causes inflammation and damage, leading to lesions or scars, the sclerosis part of the name. Because these lesions can appear in many different places, the symptoms of MS can be incredibly varied. One person might experience numbness and tingling in their limbs, while another might have trouble with balance and coordination. Some people face fatigue that's more than just being tired. It's a profound exhaustion that can be debilitating. Vision problems, like blurred or double vision, are also common. The tricky thing about MS is that it's often a relapsing remitting disease. This means people can have periods of new or worsening symptoms, called relapses, followed by periods of recovery or remission. Over time, for many the disease can become progressive, meaning symptoms gradually worsen without clear relapses. The unpredictability is one of the biggest challenges for people living with MS. But MS isn't the only player on this team. There are other, rarer demyelinating conditions too. For example, there's transverse myelitis, which is inflammation across a section of the spinal cord, often leading to weakness, sensory problems, and sometimes paralysis below the affected area. Another one is Guillain-Barré syndrome, a rare condition where the immune system attacks the myelin of the peripheral nervous system, the nerves outside your brain and spinal cord. This usually starts with weakness and tingling in the feet and legs that spreads to the upper body, and it can progress very quickly. While many people with Guillain-Barré make a good recovery, it can be a serious and frightening experience. So, what causes these diseases? For many of them, like MS, the exact cause is still a bit of a mystery. Scientists believe it as a combination of genetic predisposition, meaning you might be more susceptible if it runs in your family, and environmental factors. Things like certain viral infections, low vitamin D levels, and even smoking have been linked to a higher risk of developing MS. It's a complex puzzle that researchers around the world are working tirelessly to solve. Diagnosing these conditions can be a journey in itself. It often involves a combination of a thorough neurological exam, MRI scans to look for lesions in the brain and spinal cord, and sometimes a lumbar puncture or spinal tap to check the cerebrospinal fluid system activity. It's a process of elimination, ruling out other conditions to arrive at the correct diagnosis. Now for the hopeful. For most treatments for MS, there are many disease-modifying therapies that can help reduce the frequency and severity of relapses and slow the progression of the disease. There are also medications to manage specific symptoms like fatigue, muscle stiffness, and pain. Physical therapy, occupational therapy, and speech therapy are also incredibly important. They help people maintain their mobility, manage daily activities, and adapt to the changes the disease brings. Living with a chronic condition is a marathon, not a sprint, and having a strong support system of healthcare professionals, family, and friends is crucial. If you or someone you know is experiencing unexplained neurological symptoms like numbness, weakness, or vision changes, it's so important to talk to a doctor. Early diagnosis and treatment can make a huge difference in managing these conditions and improving quality of life. And remember, if you're dealing with a diagnosis, you are not alone. There are amazing communities and support groups out there that can provide information, encouragement, and a sense of belonging. Facing these challenges is tough, but with the right support and care, it's possible to live a full and meaningful life. Thanks for watching today. If you found this video helpful, please give it a thumbs up and consider subscribing for more health insights. Stay curious and take care of yourselves.